First of all, good evening to everyone again. Glad you all could make it here on this Thursday evening at 6:30. I'm going to ask for a little indulgence. I've been under the weather all week, so my voice is a little raspy. So if I go in and out, just ask me to repeat something, and I'll do my best. I'm going to call the meeting to order. It is 6:34 Eastern Standard Time. I'm going to do a roll call of the board members. Just please say present if you're here. Dr. Usama Bilal.
Present.
Dr. Tyre Bryant Stevens. Dr. Anna Diaz-Rue.
Present.
Dr. Marla Gold.
Here.
Dr. Jennifer Ibrahim.
Present.
Dr. Ahmed Ismail.
Present.
And Dr. A. Scott McNeil.
Here.
Okay. So we have a quorum, all but one. Okay, Ben. Okay, Ben, you got it. Great. All right. So I just want to open up and give you a little overview of what we're going to cover today. And by way of what we're going to cover, it probably will be some indication of some things that we're not going to be able to cover this initial meeting. It's been a while since we've had the opportunity to meet, so I thought we would kind of keep it broad. I know that I tried to meet with you all, but it was difficult with some scheduling on my part as well as other members of the board. So this will give me a chance to kind of pick up where we left off, where we didn't get a chance to go with those individual meetings, and then open the floor up to sort of the board with their questions or any areas they would like us to cover as we move forward. I want to talk a little bit more about some of the broad organizational priorities, highlight a few successes of the department, and then we'll go to the board for open conversation. So generally speaking, the department has sort of four big, broad priorities as we move forward. One of those priorities includes organizational competencies and operational responsiveness. Second large category is programmatic alignment with our foundational capabilities, the internal culture, which I like to think of as internal equity and operations, and then there's sort of equity speaking. As you all probably know, well, let me say, I don't know if you don't, let me say this. The department, and for a lot of the big city health departments, there's usually sort of four substantial drivers of the health and well-being of the city of Philadelphia, and similar in other big city health departments. One is injury, particularly fatal and non-fatal firearm-related events. A second driver, substance use disorder, fatal and non-fatal overdose-related events, chronic disease conditions such as metabolic syndromes, heart and cerebral vascular conditions, cancer and asthma, which is the chronic diseases and conditions are a big driver of health disparities. I'm a firm believer that if you don't address chronic disease and conditions, you can't really be addressing equity, particularly for those disparities among the Black and brown populations. And also infectious diseases such as HIV, respiratory illnesses, STI, and TB. So taking that sort of lens, the department is looking for ways to make sure that we shore up those areas, at least, not to ignore the other areas, but again, just focusing on those four areas for now for this conversation. We want to ensure that departmental resources are cohesive and geographically targeted or aligned in neighborhoods and communities of high need. One of the things that we learned during COVID, but also my experience has been in other emergency situations, whether it's forest fires, whether it's thunderstorms or hurricanes, we often work in sort of silos or apart. We pull together cross-functional teams and we stand up cross-functional systems in order to address emergencies, and then we kind of go back to our corners. And my experience has been it's important. I think we should start moving towards always operating as if there's an emergency, not necessarily promoting a hypervigilance when there's no need for hypervigilance, but making sure that these structures, if they perform well during emergencies, they can also perform well when there's non-emergent situations. as well as being ready to address emergent situations. Across these areas of morbidity and mortality burden associated with substance abuse, injury, chronic disease, and infectious diseases, there's a considerable amount of population overlap within the same geography or population adjacency due to geography. Although population needs overlap in geography or complex conditions overlap within people, public health programmatic operations operate, again, independently from one another for the most part, or it's more episodic, which reinforces the disjointedness of the delivery of services. So what we want to do at the department is make sure that we have a robust integration for assessment, programmatic interventions, and service deliveries, which are needed to adequately address the collective health and well-being within geography and within persons. And one of the ways that we're looking to do that is sort of through making sure that we enhance or advance our programmatic operations and our organizational capacity. The department received a public health infrastructure grant, like many cities have across the country, 2 years ago to enhance our workforce development, our foundational capabilities, and our data modernization. So it's through our workforce development by way of looking at recruitment, staff, skill building opportunities, workforce wellness. Also, our foundational capabilities. We have a particular focus in the health department for our preparedness division or our preparedness unit, our division of disease control, policy and legislative affairs, communications, community partnerships and civic engagement, and equity. Also, in the area of data modernization, we have sort of 3 large priority areas or 3 objectives. The first one is to modernize our data infrastructure using new and streamlined systems for ingesting, storing, accessing, sharing, analyzing, and visualizing data securely. Strengthening our data governance, ensuring that we have improved processes and documentation, data dictionaries, standardized data use agreements, better coordination with our partners within the division or within the department, as well as across the city. We want to support and expand capacity of the data staff, going back to that skill building and workforce development piece, our technical assistance, training, professional development opportunities, and community building. A few areas to note to highlight. The department just learned this week, we received the Lead and Healthy Home Grant for $7 million so that we can continue our work in the Lead and Healthy Homes initiatives. The department is also looking to develop a community health worker model, hoping to incubate it within the health department and see where we can go from there. During the pandemic, we placed resource hubs in various communities across the city, 5 resource hubs. The resource hubs have become a part of these neighborhoods and these communities. And they have sort of created a sense of being able to connect with the health department in a more direct way. The funding was tied to COVID. It was a priority for me not to lose these resource hubs. So the department is going to fund those resource hubs beyond the COVID dollars. We also received funding for our immunization information systems, about $2.3 million. And we're working with the School District of Philadelphia and the superintendent to sort of be a strategic partner as they develop some school-based health centers. And that was a lot. I'm going to drink some water here, but any questions about any of that so far?
Yeah, Commissioner, thank you very much for your review of the department and kind of level setting for the discussions moving forward. I just want to take a step back and just point out to you and Ben that I don't believe we approved the minutes from last meeting. So that may be something we still may need to do. And then if you could, because we've got public members as well, and as you level set the priorities of the department, maybe just expand a little further in terms of the role of the Board of Health and how we are involved in everything that you just reviewed.
The Board of Health has probably a broad footprint with varying depths across the department. And I think where the Board of Health has a sort of the more prominent imprint or footprint, if you will, it's in our sort of policy and legislative activities, um, and how that connects to our city council as we work through different um, policy prescriptions to address health issues in the city of Philadelphia. But it's not limited to that as well. I mean, I think of the Board of Health as an opportunity to get feedback, to consult on some of the initiatives that we take on as a department, whether it be equity, whether it be civic engagement. Um, so it really can vary. I think usual and customary, I think of it in terms of regulatory activities, but it is certainly not limited to that. Does that answer your question, Scott?
And I'm just going to jump in because before we start,
Yep, yeah.
I
Before
know
we
there's going to
start,
be
yes,
a lot of discussion, and Dr. McNeil, thanks for the reminder. I think
yes,
Dr. Franklin, you should
absolutely.
just
Yep,
approve the minutes well before we jump in.
absolutely. Okay. First of all, let me ask all the board members, have they received the minutes from last meeting?
Yes.
Okay.
Yes.
All right, great. Is there a motion, or are there any questions or concerns regarding the minutes?
No.
Seeing none, hearing none, is there a motion to approve the meeting minutes?
So move.
Second.
Second.
Okay, the motion has been moved and properly second. If there's anyone in opposition to the acceptance of the minutes, please raise your virtual hand. I already know you had yours up for a question, so
No,
I believe
I'll
that's,
lower it now just to be
yeah, okay,
consistent.
okay. Okay, seeing no objections or abstentions, I'm going to say that the meetings have been accepted. And we can go back to, we're good, Ben?
Thanks. I'll just jump in and I did put a message in the chat for members of the public, but I'll just do my public comment disclaimer here before we jump in also. Members of the public, if you'd like to submit a comment or question to the board, you can do so by using the chat function on Zoom or emailing them to me directly at benjamin.hartung, HARTUNG @phila.gov. The board is not required to respond directly to your question, but they will review it, and it'll be a part of the record. And I also need to disclaim that this meeting is being recorded per city ordinance and will be posted online on the Philadelphia Department of Public Health's YouTube channel. And so your participation in this meeting constitutes your consent to be part of that recording. Thanks. Back to you, Dr. Franklin, or I guess Dr. Ismail, if you have a question.
Thank you. I don't have a question. I just want to add to the initiative with the school district. We have opened a clinic about 2 years ago. It's a 4-chair dental clinic, the first of its kind in decades, at William Kelly Elementary School. And it serves several schools in this area. And tomorrow we're going to Widener Elementary School for physically disabled children, students. I think the model, there is a lot of need for support for students in the school district. And I think it would be nice to have a collaborative effort with the department, with your department, to develop a school-based care and prevention and promotion model, not just for the children, but also for their caregivers.
Absolutely, I'm in agreement 100%. The meeting I had with the medical director, Dr. Kendra McDowell, and the superintendent, Dr. Waddington, they gave me sort of the historic landscape of the ups and downs, the successes and challenges of school-based health centers across the city. So we are coming back together, or we're coming together just to figure out how to make that work. But let me ask you a question, if you don't mind, Dr. Ismail. Did you get the did you set that up through the principal or the?
No, I send it up directly with this. Well, first through the president of the school board at the time. Then that led to the superintendent, and that led to the selection of a progressive, innovative principal, Dr. Crystal Edwards, and took us 5 years actually of work to reach a level of having a clinic on the ground of the school. So we learned a lot from this experience. Basically, all the cost is paid by Temple Dental School. And it's a very modern clinic and very beautiful clinic. And we're increasing the utilization of the clinic. It takes some time for people to have trust. And we added also the caregivers into the care model. Tomorrow we're visiting with officials of the school board to go to, so that you will see it. And then we're going to move to Widener to see whether we can expand. There's only one school in the district for physically disabled children using wheelchairs, and that's Widener. So that's an opportunity where we can do things there.
Great. Okay. Well, I'm going to take it that you've got that 5-year learning curve compressed into about maybe a year.
Yes.
Okay. Great. Any other feedback or questions?
I don't have
Sure,
questions.
Marlon.
Yeah, thank you for sharing that information. While I don't have questions about what you've shared so far, my questions focus on the overall public health or the health of those who call Philadelphia their home at this point in time. Certainly the preparedness, readiness, infrastructure, competencies are critical in order to respond. But as you know, unfortunately, people and their wellness don't wait for us to have infrastructures together, any of us in those areas that we work. So not as a punch list per se or a laundry list, but in general, when we talk about equity and just the inequitable way tied to racism and poverty, particularly in our city, as well as other historic issues, that health outcomes happen, how will we receive moving forward? And then about our role, data on how the city is doing overall, that, you know, for those reasons, then that you're going to these priority programs.
Make sure I got the question clear. So how will the board receive data and updates regarding sort of the overall well-being and health of the city?
Yeah, in other words, I no longer, and I believe it's true that the board doesn't have, and a lot's gone on for you and the department, but there is no sense of the whole anymore, as in the entirety. And there's no understanding of what the big issues are facing those people who call Philadelphia their home at this time. And during the 9 months that we haven't gotten together, issues such as what took place in Kensington, issues such as how the wonderful clean and green initiatives, I feel like every government leader comes in with something that's so public health and I get excited, right? So clean and green is public health. And you know, what's the PDPH role in that? Another biggie is Chinatown and what's happening there and how it'll affect the people that live in this vital neighborhood. And the list goes on. The question is how we catch back up to that and understand the whole. And I didn't mean to leave out OD, substance abuse, what's going on in the city. I've been getting my news from WHYY.
Well, let me parse that out for the members of the board and particularly the members of the public on here. A lot of that information in terms of the health and well-being of the city is still being produced by the department. As a matter of fact, we just released a press release the other day about a reduction in deaths associated with substance use related events and with some of the leading causes of death that sort of landed upon us during the point of COVID. They're sort of going back to pre-COVID. I don't think normal is the right word, but homicide deaths have gone down. And so we did a press release on that, and our Health of the City dashboard is publicly available. But if you're talking about specifically how we can get information in a cohesive way to the board, you're right, that has not occurred. We have been in a lot of transitions at the city level as well as the departmental level. So it's been me trying to catch up in my learning curve to get organized around that, actually. So as we move forward in January, the cadence of the meetings will be quarterly, and we're working with the data analytics team to put together a report that we can send out, a sort of broad overview of some of the issues that are going on, with a particular priority with those seasonal issues. So more to come, but you won't have to solely rely on WHYY, but I totally understand sort of the feeling of it being less cohesive. I think, yes, Crystal. I should have Crystal.
Well, there was another hand up before. Mine.
Okay. Oh, you guys are jumping around. Dr. Ibrahim.
Sure. So I just wanted to tack on to what Dr. Gold had said, that I know the last time we had convened was at the end of January, and I was looking prior to the meeting, looking back at the strategic plan, the 22 to 26 strategic plan. And I know that there was an annual progress report that came out, I think February or March. I think it would be helpful to, in addition to getting the data, having some time to be able to process some of this together. And where there were successes, what's at the root of some of those things, where there are still challenges, how can we engage, how might we, bring to bear experiences that we are aware of in other jurisdictions that may be useful. But to the point that you had just added about meeting quarterly, I would ask that to get caught up. I think when we're back into a regular cycle, meeting quarterly can be perfectly fine. But I would ask in the interim, until we get caught up, even for the items that are in the annual progress report, even if we could have reports and updates on those key initiatives, I think that would be helpful. If we could meet more regularly, maybe meeting every other month, just to get up to speed, because I think we're all in the same mindset that we want to be useful. We're here at your, to be useful for you, for conversations, for discussion, and thinking about where there are ways that we can, as a collective, could bring something to bear and try to process some of these things.
I appreciate the consideration, the recommendation. We definitely consider that. We'll see how people's schedules are. Are you suggesting every other month for what? The first 2 quarters, and then we go into?
I think if we could get through, some of the big issues, I definitely agree with Dr. Gold. Kensington is a big question. But I think if we could get through some of these things and we feel that we're back into a regular cadence, I think that's fine. I wouldn't say it's this number or that number. I wouldn't want to make that specific recommendation, but I think having greater frequency for us to have these conversations would be useful. I think then there's opportunities for us to think about it in the interim and come back and have a more informed and robust discussion.
Certainly. Thanks a lot. Crystal.
I'm sorry, I'm trying to lower my head. Thank you, Dr. Franklin. I met a couple of you, but not all of you, and just wanted to take this moment to introduce myself and to provide some of the information about the mayor's initiatives, and also possibly the reason why you haven't gotten direct communication around those initiatives. But my name is Crystal Yates Gale. I am the Deputy Managing Director for Health and Human Services. So I work in the Managing Director's office, and the Health and Human Services cluster includes the Department of Public Health, the Department of Behavioral Health, the Office of Homeless Services, the Office of Domestic Violence Strategies, and the Mayor's Commission on Aging. So I just wanted to introduce myself and talk about the cluster. I'll talk a little bit about I have 2 big priorities as we're in this new administration. My first priority is to have our health department, our behavioral health department, and all the other agencies in the cluster to work more cohesively so that we can address the people in Philadelphia as a whole. So that's one thing. And the other thing, we all know that our aging population is growing. And we'll expect to be about 1/3 of us very soon. And I don't think that I love my city, but I don't think we as a city are prioritizing and preparing appropriately to serve our aging community. That said, I also want to talk about, thank you for bringing up the mayor's clean and green, our efforts around Kensington, and some of what we're discussing around Chinatown. And I wanted to not make an excuse for Dr. Franklin, but say that our mayor is very deliberate about how she wants messaging to go out. She's very deliberate about none of us getting ahead of her. But now that most or some of the information, but not all of it is out, I can share some of it, so you don't have to only rely on what you read in the Enquirer and hear on WHYY or KYW. I also caution against only believing the information that you get from those sources. And I understand that's why you're asking to hear it from us. I do get that, but I do want to say we have not necessarily marching orders, but we know that we don't want to get ahead of her. So I want to go first with clean and green. The thing that the mayor is focusing on, she talks a lot about not wanting to be known as Philadelphia. And so it was her effort to do a full street cleaning on every city block in the city during the summer. I think that the Office of Clean and Green was successful at those efforts. And there is, I think, a dashboard or some information that we could get to you. I'll send it to Ben and ask Ben to get it to you to show the results of those efforts. Green, same thing. We're trying, I think when the mayor speaks about green, she's speaking about it in two ways: greening and beautification efforts, and also green sustainability. She's working on both. And then Kensington, any questions on clean and green? I don't know. If I can't answer, I will get an answer and get it back to you all.
People are noticing that the city is getting cleaner, so just to let you know.
And I've noticed it also when I'm driving on the way to work. I have noticed. I am interested. I don't know if you all saw the article in the Enquirer as to whether it's been sustained. And, you know, it's not perfect, but you continue so that people change their behaviors. Around Kensington, we are working very hard and aggressively to build out our wellness ecosystem. We have stood up a low barrier shelter that I'm sure you've read about in the newspaper at 2100 West Girard, the old Philadelphia nursing home. We did get a significant amount of pushback from the residents in that community. We understood the need to engage more frequently and engage prior to putting in the shelter. The community surprisingly was unaware that a shelter had existed there for several years, and the community was unaware that we had about 130 people there, plus 90 during the winter months. We created a 90-bed floor for I think most of the people that are participants there are from the Kensington area, not residents of the Kensington area, but they had been living on the street in the area around Kensington Avenue. So as of today, we have a census of 72 participants. I think there are 3 couples. That's part of our goal of low barrier. There aren't any shelters that allow couples to come in together. We're working on expanding the beds available there to include another floor and another 90 beds, and we anticipate that will be done very soon. Some of the questions we frequently get are, how are admissions handled? Can someone walk up and say they want to be a part of, we call it Philly House at Girard. We take participants in only through our outreach coordinators. And to date, I think, I said 72, but I think today's census was 73. We are currently, this was another thing that was held closely and tightly, and this is, I think, I can't speak for you, Frank, but I know the reasons why you have not communicated all of this information, because we haven't given the thumbs up to communicate much of it. to not get in front of the mayor. But we are working aggressively, very aggressively. We have contractors that are scheduled to start construction 24 hours a day, 7 days a week at Riverview campus on State Road. And we will be opening that campus to serve as our Riverview Wellness Village. The date that the mayor has given us is December the 31st to make sure that it's ready and able to accept patients. That village will be a sober living community. It won't be a low barrier shelter. We will be working with the Department of Behavioral Health to assess bed capacity from the behavioral health substance use treatment providers. They have reached out to us and told us that they're able to increase capacity, but the demand is not there. Voluntary demand is not there. So on any given day, there are 100 beds across the ASAM level of care that are available. We plan to meet with them soon because the Office of Public Safety will be starting a wellness court similar to the diversion program. So we anticipate that we will need increased capacity. So we'll be reaching out to the treatment providers to find out their realistic and pragmatic number to increase surge capacity in their bed space. Our goal is to then provide the carrot of being able to be discharged into the Kensington Wellness Village, continue outpatient substance use treatment and supporting therapies, employment programs, housing, and so on and so forth. We want that to be a campus that you envision when you see commercials for treatment facilities in Florida. So that will be December.
Can I just ask, is there a role at all for needle exchange embedded somewhere in these programs, or have we, I understand about funding issues, but the actual needle exchange that's been set up, will this be continuing in any way, anywhere for Philadelphians?
It's my understanding it will continue along Kensington Avenue with the partners that provide needle exchange services already. The city, though, will not fund needle exchange. The mayor has asked the philanthropic community to step up and fill that gap. We will not do needle exchange at Philly House at Girard, even though it's a low barrier shelter. We don't do needle exchange there. And the Wellness Village will be a drug-free facility.
Thank you.
You're welcome. Any other questions? And then I think you mentioned Chinatown, and I don't know if you're talking about our Stitch program.
Looks like Dr. Abraham, do you have a question regarding up to this point?
I do. We can come back. You can continue and I can ask it afterwards.
No, ask it now. We're here.
So I just wanted to know if you could say a little bit more about the wellness court.
I'm trying to, I need to think about what's been released publicly. I'm not sure how much has been released publicly. Do you have a specific question about what the wellness court will and will not do?
And if you can't elaborate more on that now, maybe that's just something to put on an agenda for a future meeting when more has been released. I just want to understand what that mechanism is going to look like. What is the process for being referred to the wellness court? Just some understanding of how it would work.
Okay, I can give some information, and I would recommend that it goes on the agenda item for the next meeting so that I can reveal, a better explanation.
Sure.
But it will basically work where if someone is arrested on Kensington Avenue for open drug use or the possession of drug paraphernalia, they will be allowed to and think the wellness court will be initially rolled out 1 or 2 days per week. I'm trying to be very careful about what I say, so please forgive me. And an individual will be given allowed the option of accepting treatment instead of incarceration. And then that person will be connected to treatment by someone in the Department of Behavioral Health. I think that's all I could probably explain right now.
Okay. And that's fine if we have it on a future agenda. And then just one other quick follow-up from Dr. Gould's question about needle exchange. So I understand needle exchange not being provided by the city, but in each of these facilities, is there access to wound care?
There is access to wound care at Philly House at Girard, and our hope for the Wellness Village is that there'll be access to wound care and also access to primary care, medical care, and care for chronic diseases and others. Yes.
Thank you.
You're welcome. And then for Chinatown, Dr. Gold, can you elaborate?
Yeah, and I didn't mean to,
what-
thank you, and thank you for this. I was giving examples, broad strokes, rather than saying STD, HIV, ABC, if you would. And I know we have members from the public at our meeting as well. So I'm not asking for specifics and diseases, et cetera, but just to get a picture of the whole under a number of initiatives. And it sounds like there's a fair amount of movement in Chinatown. In the bits that have been made public, for those of us, however we get our news, I didn't see much about the health outcomes, projected health outcomes or impact of a stadium coming into that location on the residents. There's a fair amount of economic data, right? How Chinatown might do, et cetera. But I haven't seen anything about the total. And Crystal, if it's okay to call you that, I'm sorry. Okay, Deputy Commissioner. What I wanted to say is, I think most of us on the board are used to, it's not a control issue, incubating with leaders like yourself, balancing things off. Some of us are experts in outcome data. Some of us have very strong and broad epidemiologic backgrounds coming from different places, though. We would ask what other models, for example, Philly's looked at. I'm sure you've looked at other large cities and creating a court. Did it work? Did it not? Why do we think it's going to work here? These are the kinds of conversations, the to and fro, if you would, that we're used to. So if there's a change in operation and we'll hear, and I understand when the mayor's ready to announce, that's why you see us kind of stumbling in the dark a little bit here, because each one of us will say, oh, wait, I know about that evidence-based program, or those who've been on the board for several decades. Scott, you know who you are. We might have said, oh yeah, that had a different name, but we tried it already and it didn't work. You know, why is the city ready for it this time? So I'm just trying to understand the flow of information and how we might have these discussions.
And we appreciate that. Frank, I'm sorry to jump in and then I'm going to be done. And we appreciate that. And we do believe that we'll get back there. I think the fact that we have a new administration and this is Mayor Parker's first year, they have some trepidation about exactly, you know, how all of our systems work together and what communications happen. Because I'll just be frank, some of what her initiatives have gotten to the public before she was ready to get them to the public. So as you all know, that causes you to hold the information closer because you don't know how these things happen, especially when you say, oh, we're not really ready for prime time. We're having discussions, we're talking about possibilities, and then things get out. I think that's just made her a little more cautious about even sharing with me sometimes and Dr. Franklin, like and our commissioner of the behavioral health department and so on and so forth. So I think it will get better. I do. And when it gets better, we'll definitely reach out to you all for your expertise, especially in these areas.
Thank you. I appreciate that.
Thank you. Thank you for giving me the opportunity. Thank you, Dr. Franklin, for having me at the meeting.
Did you want to
Absolutely.
comment on Chinatown and health outcomes?
Well, I was going to talk about the Stitch project. I'm not sure if you would, I thought you were talking about the Chinatown Stitch, but you're talking about the 76ers arena. Although we had a very long press conference with a lot of information, you're right, not much of it was health related data. I don't know if any of the reports that were done, I think the city was careful to make sure reporting was done that they received were independent reports so that the mayor could make an informed decision that was not biased. I think when this first started in the last administration, the reports that were provided to Mayor Kenny were completed by the Sixers organization. So Mayor Parker contracted with several firms to provide a independent opinion, and I don't believe any of them had health related data, but we will look to see if there are any reports with health related data that we can share with you.
I'd appreciate that.
Thanks, Dr. Franklin.
Absolutely. Thank you, Crystal. The floor is still open.
Yeah. Sorry, I wanted to ask about what I think from, according to Philastat, is the seventh cause of premature mortality in Philadelphia. Oh, can you hear me?
Oh, go ahead. Yeah. Okay. Sorry.
Yeah. Seventh cause of premature mortality in Philadelphia, which is motor vehicle crashes. And specifically as someone that commutes by bicycle, I'm always worried about the environment around me when biking. And we've had several deaths in the last few months, including of children and including of many people. I know Vision Zero was a slash last year in terms of funding. Sorry, earlier during this year. And I'm worried about the lack of plans around addressing this kind of deaths. The Washington Avenue Road Diet only happened partially. We know there is a big area there where children cross all day to go to school, to coping. So I'm just wondering about, in general, PDPH or the city plans for addressing pedestrian cyclists, and in general, any user of the road deaths and injuries.
Yeah, most of our that work sits in our injury prevention program, which is with our chronic disease division. It's kind of all collapsed, the division of chronic disease and injury prevention. And we've done some recent analysis with some of our injury epi folks regarding sidewalks, pedestrian crashes, working with the Bloomberg Institute to try to figure out ways to support that work and drive it further in terms of policy. So I will have the program manager send you some information about where we are with that. And some of the direction, trying to build out our work. I'm an injury epidemiologist by training, so I have an appreciation for all types of injury, and I know that often it gets focused on, and understandably so, on firearm-related events, but there's a significant amount of mortality and morbidity associated with pedestrian crashes due to lack of sidewalks and things like that. So point well taken, and we'll follow with you outside of this, Dr. Bilal.
I have a very specific question, and it may be best addressed outside of this forum, but I think it's might be appropriate to raise it in here. And it may be something even Ben can comment on. As you know, this board spent in the last administration most of our time addressing COVID-related issues, and ordinances and changes. And during that time, we were passing many things very, very quickly, understandably so. There was a COVID leave policy that was specific for healthcare workers that I know within a lot of the healthcare facilities, there's still some level of confusion as to whether that policy is still in effect. Because at the end of the last commissioner's realm, it was stated that there needed to be an act of legislation to actually repeal that COVID leave. And I don't know that that's ever happened. So there are healthcare facilities, and I know only because they come to me as a member of the Board of Health, and unfortunately, I plead ignorance that I don't know what's happened either. So just
And
kind
me
of,
as well.
I don't, yeah, I don't expect an answer, but it is something. It's hanging out there, kind of the. And of course, we did see this summertime spike of COVID, and we don't know what the fall is still going to entail. So but there are people asking that question as to whether that policy is still in effect, and if it's not, how can it be changed?
Ben and I were just talking about that today in the last couple of days. Ben, you want to give him an update?
Yeah, I don't know how much we can say publicly at this point, but
Right.
it's definitely on the radar of people in city council. Let's put it that way. So I would expect
Great.
I would expect there to be something introduced soon that would start to try to address that, I guess, is I think what I'm allowed to say in terms of client
Yeah,
confidentiality.
it's definitely on the radar. A couple of hospital systems have reached out to me about that because of the challenges that it now pose, given that COVID has subsided. So on the radar, on the front burner. Stay tuned.
I would just note at this meeting, and thank you for that I've already sent in to you and other members of the board in writing concerns in terms of the catch-up, some of which we've addressed tonight. Moving forward, perhaps, as we increase, I think you've stated there'll be an increase in the frequency of board meetings for a little bit. And if they need to be public, so be it. In the past, we've also had non-deliberative small meetings that were under legal allowed. But that's so we know. I mean, bird flu's kind of flapping out there, if you would. There are a number of other issues. Understanding the city's preparedness and planning, since we, for example, did not flip the switch on points of distribution or pods the last time around. And last we knew there was going to be review of that and a whole new way perhaps of doing that should we hit another epidemic pandemic in the city. So perhaps moving forward, we can get updates of where things stand in terms of the city's readiness, if that's still under the health department or if it's changed under the new administration. I think that's a critical issue.
Marlon, I'm Dr. Gould. I'm sorry, I missed what you were saying in terms of what was under the lap. What you said something about hitting the switch. What exactly were you?
Those are pods. In other words, for a long, long time, dating back to 9/11 and the unfortunate and horrible events that happened, the city's preparedness plan under the health department umbrella was built on a system of points of dispensing, if you would, or points of distribution. They were all over the city, also universities. And I want to point out I'm retired from Drexel, so I'm not representing the university, nor was I ever on the Board of Health. But at any rate, universities and other large institutions were themselves pods. There were trainings and drills with the health department year upon year, and people prepared should we need to dispense a vaccine, a life-saving drug, well, even masks, for reasons that are very clear. The pod route was not taken. There was a lot we didn't have to do it that way. But that system, which has been out there with drills, was supposed to be reviewed and reformatted. So I guess I'm really sorry to be long-winded tonight, but the specific question is, so what's our plan? And I don't expect anybody to answer that at a public meeting this evening. But understanding what the plan is, because the likelihood of something around the bend is exceedingly high, is important for those pieces, understanding even that there is a plan. And back to Crystal, and again, Deputy, just to say, I'm aware there's a struggle here with information, and I'm aware of that. And I hear the catch-up piece. But again, the expertise and role of the board is to look at the conditions in which those who call Philadelphia their home can flourish. And the catch-up period here is pretty robust for us to understand what's going on and to be a part of that as per the city charter.
So let me make sure I'm clear. The pods were something that were used prior to the pandemic, but they weren't used during the pandemic. And the thinking was that they would be resuscitated.
No, the thinking was, it's really asking about, or we can have a devoted session to the city's preparedness for a disease outbreak,
Okay.
especially airborne, particularly
Yes.
because it is a matter of time where
Yes.
we likely see human-to-human transmission, for example, of something that we can pop a vaccine pretty quickly and get it out there, but what
Mm-hmm.
the city's plan is. As
Okay.
horrible as COVID was, the thing that was lucky is there wasn't an overlapping pandemic or problem at the same time that would take us down. Understanding our readiness and how the systems are set is very, very important. I have concern that it'll get lost because of this sense of
Okay. No, I think I got distracted on the pods piece as opposed to the actual question being sort of where we are in our current preparedness plans, given that we are pandemic. That's really more the question, right?
post-COVID pandemic. Yeah.
Yes, that's what I mean. Yes. The last pandemic we had was the COVID one. Yes, yes. As far as the catch-up piece and the more frequency of meetings, it probably will be a hybrid of in-person, public, as well as non-deliberative meetings among members of the board.
Can't overstate the importance of it at this point.
You sure can.
Nope.
Absolutely. Does anyone else have any feedback or comments or? Okay. Well, this has been great. I'm looking forward to catching up with you all and addressing all the items that were mentioned here today as we move forward. I have my one homework assignment right here is to make sure we get the information around the injury work with pedestrian crashes to Dr. Bilal. All right, there's no other. Oh, yes, Jennifer.
I just
Sorry.
had one other logistics question was just around scheduling. And so I know that you had mentioned that that was previously a challenge, but just what, Ben, I don't know if that's, you'll be reaching out floating dates. I'm happy to rearrange things, put things on the calendar, tentative holds, et cetera. But I just wanted to ask about next steps with the logistics of scheduling.
Yeah, I think I was referring to the scheduling of trying to get together with individuals less than a quorum. That became more of a challenge. So what we're going to do is try to, well, initially, as I mentioned, we're going to meet quarterly. We'll put quarterly dates on the calendar, so that will be set. And I think once we put the quarterly dates on the calendar, like January, March, or April, whatever that is going to be, we can fill in the in between. But I want to put the stake down on making sure that we have at least 4 public meetings, and then we can sort of build out or build up what's going to happen in between, whether it's public or whether it's members non-deliberative conversations for information.
If you would send the information that Dr. Bilal asked for to all of us, I think that would be helpful. And perhaps it's a topic that we could talk about at a future meeting, I think, as well, since it is a, key health issue in our city.
Sure. Okay. Well, seeing no more questions or feedback or input, I think we can call the meeting to end and adjourn our meeting today.
Bye.
All right, then we adjourn at 7:28.
Thanks, everyone.
Good evening.
Thanks,
Thanks,
everyone.
everyone.
Everyone.